my name is Dee Bloomberg. Some of you may know me. For the past 5 years or so, I've worked as a protocol specialist for the CTN Clinical Coordinating Center at the MS Corporation. I've been the protocol specialist for the 48, 51, and 55 trials. My background before then is in social psychology with a particular expertise in self-regulation models. And actually, when I first heard that there was such an interest among the CTN group in emotional brain training, I thought I would learn more about it so that I could present to the larger group here. But fortunately, I reconsidered and went right to the source. I contacted Dr. Laurel Mellon, who is the founder of EBT and who graciously agreed to present to our group today. Dr. Mellon is a health psychologist and an associate professor of family and community medicine and pediatrics at the University of California in San Francisco. She is the founder of EBT, a method of rewiring the emotional brain to decrease allostatic load, which she will describe in more detail for us today. She also directs the Solution Foundation, a nonprofit organization that promotes awareness of training the emotional brain. Her research interests include stress, allostatic load, addictions, obesity, depression, and the treatment of stress-related conditions, with particular emphasis on the underserved. Now, before I hand over the stage to Dr. Mellon for her presentation, I just want to take a moment to review our learning objectives. What we're hoping today is to be able to define emotional brain training and discuss the science, the scientific foundation behind it, to explain the implications of EBT for addiction and other extreme behaviors, and to discuss EBT methods that are used in healthcare settings. And one other thing I'd like to do is just take a quick poll. For those of you out there on the line, how many are familiar already with emotional brain training, with EBT, either personally, professionally, or otherwise? So let me give you a minute to respond. If you could just click on the yes or no, and in just a few seconds, we're going to show those results. Okay, that is very interesting. This is really interesting. So a few of you are familiar, do have some experience. Most of the group does not have previous experience, so that's great. I know we're all going to definitely learn a lot from this presentation, so that is very good to know. And with that, let me hand it right over to Dr. Mellon. Thank you.
I'm very grateful, Dee, for all your support, and for Tracy and for your whole team. And it's a real privilege for me to be here speaking with all of you and part of this CTN web seminar. So hello, my name is Laurel Mellon, and I'm going to actually go through a quick group of slides that just tell you a little bit about the history of EBT and what it is, how we use it, and what are the implications for substance related problems and extreme behavior. So first of all, I've been a faculty member at UCSF for a long, long time. And I started off with an interdisciplinary program on adolescent health, focusing on addictive drives, particularly related to food, and realized that with CBT, we really were not getting at the root cause. Some people did it better, some people did not get better. And I began looking into the literature. And way back in 1940, Hilda Brooke, who's a psychiatrist at Baylor College of Medicine, had done a beautiful study on the family frame of obese children, looking at patterns in the family of neglect, abuse, and permissiveness. And at that point, I'm 66 now, and I was in my late 20s. I thought, well, that's a skill insufficiency. I bet we could teach developmental skills, nurturing and limits. And we began to do that in the clinic, training families for a family system approach for emotional connection. And one little girl came up to me and said, you know what, I stopped the drive to overeat. I don't know what's going on, but it's just gone. That was before the decade of the brain. We didn't know we were changing the limbic brain. But we began to expand it to adults simply because of demand. Parents said, I want these skills, and to see it not as related to food addiction or obesity, but to all stress-related problems, and essentially a way to reverse allostatic load. We continued with treating adults for all stress-related problems. Oftentimes they were related to survival circuits, which are addictive circuits. And the method, we stopped in 2007, and we said, we're very close to getting the tools to rewire the emotional brain, which is the motherboard of humanity. So we stopped for 2 years and just went deeper into the science, and then resulted with a more simplified, more essentially brain-based, neurophysiologically based alterations in the previous method, and called it emotional brain training. By 2014, we had 10 evidence-based studies that showed continued changes after treatment ends, which suggests maybe we're getting at the root cause. And only this year did we moved to technology in 2012, because to rewire the brain, you've got to have a lot of practice. And we found that people preferred the convenience of telegroups, and they needed to have e-learning and apps and really have a lot of support to make that accessible and feasible. So that's when we moved to tech-assisted EBT, and really in 2012, but a more improved version this year. So first, let's look at the science of EBT. And essentially, we're looking at failure of self-regulation as the chief cause of most addictive drives. And it turns out that when there's a failure of self-regulation and others being stuck in stress, the circuits that are formed then promote stress reactivity and reward-centered dysregulation. So the two systems go hand in hand in the circuitry in the brain. Again, all of this is related to neurophysiology and a brain-based approach to addiction. What happens is these allostatic or ineffective circuits that are encoded during stress easily can become dominant because they're stronger than the more adaptive circuits. And the dominance of these circuits is the root cause of 80% of health problems that are stress-related, including substance abuse and disorders. I'm going to move pretty quickly through this, and because we have limited time, I'm going to try to do this rather quickly and then come back around at the end to answer your questions. Now, the important shift in the paradigm here is we're focusing on self-regulatory circuits. You've heard a lot about why are we focusing so much on chemicals, why don't we focus on circuits? But if we're focusing on circuits, the idea is, since most problems are failure of self-regulation, let's equip people with the self-regulatory circuits that promote a sense of connection, secure attachment, neural integration, and health. So it's important to know that when you start thinking, not in terms of stress symptoms, how many drinks does the person have, how many pills, although that information is important, you start to think in terms of circuits, it's a new world, because these circuits integrate emotions, expectations, and responses. So we can't see the behavior as separate from the circuit. The problem is the circuit. These circuits are subcortical. They're stored in implicit memory systems in the emotional brain. They're activated in 3/10,000th of a second, and there's no source attribution. When you get activated by a trigger, you have no idea it's a memory that's being reactivated. It really feels like this is just what you consciously are doing. And also that these circuits can be basically helpful, homeostatic circuits, which are effective, moving us through stress, back to a state of connection. They flicker around a little bit. We can move in different brain states with them. Or they can be ineffective, which is allostatic. It's a completely different kind of wire. These get stuck on. They're positive feedback loops. You can't interrupt them internally. You need an external to go to. And if it's not a person, it may be a substance. So we're going to talk a lot about that here. And first of all, let me just double check that. Yeah, okay. The homeostatic circuits are the good guys. Basically, the three parts. At first, when we respond to something, we respond emotionally in an effective way. We, on an unconscious level, know what we expect in order to move forward, to get less stress and more reward. So our expectations are reasonable, and we actually respond in an effective way to get back to a state of connection, which is what the brain wants. Okay, so here, in order to understand this, and again, this is an educational intervention. It is not psychotherapy. It is brain training, emotional brain training. And so we explain all of this to the participant because we're giving them the support to actually do the rewiring themselves. It shifts the focus. They're in charge, and they need to do the work. So these circuits, we have fun pictures, such as the idea of using the triune brain, that these circuits go through the entire brain. And here's a picture of a homeostatic circuit, a representation. Let me give you an example. Let's say that there's a stimulus. Let's say my partner criticizes me. It goes right into the thalamus, and it picks up a wire, and that wire that it activates includes an effective emotional response. Oh, I'm stressed out, but I'm not overwhelmed. That leads to expectations that are reasonable. I expect myself to talk through with my partner how that feels to me and what I need. And so the corrective response in this case would be, I'm going to speak up and talk to this person even though I'm not very happy about it. But the reward is integrity, that I know that I'm doing the right thing. What's important to know is that these circuits include both a response to stress and the attainment of some kind of reward. So the reward systems and the stress systems are included in these circuits. So how do you go about getting these great homeostatic circuits so we can move through stress back to a state of connection and the drives for substances would decrease? Well, let's go back to how the brain operates. We know that for all people, male, female, whatever your sexual orientation, race, socioeconomic status, all of us subcortically have 5 different brain areas in charge based on our level of perceived stress. So when we're at a brain state 1, feeling great, the top part of our brain is in charge, which is more balanced. And as we move into stress, we go into the lower areas of the brain, which are more extreme. So they're very diverse and extreme based on the areas that it's being drawn upon for memories, based on state-specific memory. So it means that if you look at secure attachment and basically the connection between a parent and child that's essential for survival of the species, it's the parent's job is to download into the baby the state-specific process for each of those 5 brain states that will bring them back to a brain state of 1, which is best for health, happiness, and development. If you look at the parenting style associated with secure attachment and neural integration, which is an authoritative parenting style at each of those 5 levels, there are distinct processes that parents use to get that brain back to a state of neural integration. Now, if that, in fact, there is success with self-regulation, the brain essentially encodes basic expectations, extracts from those experiences basic expectations about life. We call those core circuits. And those circuits are, I do exist, I am not bad, I do have power, I can do good, I can love, I am worthy, and I have joy. This creates resilience. So when the boss criticizes him or something goes wrong at work or a child is sick, that stressor enters the brain and it bounces back well for resilience because I have this safety net that I do exist, I'm not bad, I do have power. So there's not the secondary stress that would be there otherwise. This is the foundation for resilience. If those resilience circuits aren't working, then when stress is hit, we're more likely to encode maladaptive circuits. But in this case, the survival circuits, that you're probably familiar with, survival circuits are really important, as you know, to addiction. Survival circuits detect key trigger stimuli to activate functions that allow organisms to survive and thrive. So essentially, they are over-remembered because we know they're our survival basis. And they're protected in the brain from rewiring because the brain believes that these survival circuits are going to keep us from dying. With a responsive environment, what happens is these innate survival circuits stays unaltered, so that in fact during stress we implicitly know that I get my safety from emotionally connecting to myself and others. We know that we have higher order pro-social rewards. We have the room for that. We do things for the right reasons, and that's associated with survival of the species. We care about our young, our old. We save for later. And with these survival circuits not changed, we can more easily move through stress and feel rewarded by hedonic or pro-social rewards. Okay, now the other side of the story, which is if the experience has been ineffective emotional response, overreacting, underreacting, in fact, what happens is the offspring's brain, and this is encoded in the last 3 months of pregnancy, first 3 years of life, and later only during stressful situations. But these are the other representation of the other kind of circuit, the allostatic circuit, where the emotions are essentially maladaptive and a prolonged. So we go into a prolonged stress state in which other allostatic circuits are activated, and basically we have a garage band full of ineffective responses to life, which can be prolonged. Okay, so essentially in this case, for example, my partner criticizes me, and I go right into a full-blown stress response. I either dissociate or hyper-arouse. My expectation is I'm going to do whatever it takes. It's a survival drive to get what I want when I want it without caring about the future or other people. And so essentially I'm passive or aggressive with my partner, and I can't get those pro-social rewards. The reason I can't get those pro-social rewards is because in stress the brain is split. And the thinking brain, the prefrontal cortex, and the emotional brain is split. So the projections between the prefrontal cortex and the emotional brain, which would allow us to think about our higher order purpose of doing the right thing, is really cut off. So it can't get down into the reward centers of the emotional brain. So we can't get the needed reward from anything else than hedonic rewards. So what am I going to do but have a fight and then go to the refrigerator and get or the pill bottle or whatever I have to do, and that's what these circuits do. So in effect, when we're raised in that way, without the self-regulatory emotional skills we need, what's encoded in the brain is maladaptive core circuits or core beliefs. I do not exist. I am bad. I do not have power. I cannot do good. I cannot love. I am not worthy, and I cannot have joy. And that sets us up to not be able to have a secure connection and to feel that sense of peace and power from within. And naturally, we have nowhere to go but to be stuck in allostasis and getting our safety from whatever we reached for in that moment that took us out of being present to ourselves, whether it's an emotion, a state, a behavior, a relationship. And we have to rely on those hedonic rewards, which work in the short term but become repetitive and addictive in the long term. This is a series of slides that just share a little bit more about these circuits. There's great articles on that you can read, but essentially survival circuits are taking basic survival needs, and essentially we learn to activate a full-blown stress response about things that are really not a threat otherwise. And when we activate those circuits, they get attached to other kinds of responses and then over-remembered by the brain. This is what's important. They go right to the bottom of the brain, and long-term potentiation means they're over-remembered. And what happens is if you try to activate that circuit, you will actually be at the refrigerator overeating, or you will be shooting up, or you'll be taking a pill, and your mind just shuts off, and that's what you're doing. So they're very hard to reconsolidate. We know that they get locked in, but they can be reconsolidated when we're in a period of stress. So when we have interventions that do not stress us out, we keep those maladaptive survival circuits protected from reconsolidation. So cognitive approaches, being aware, sounds good in the short term, but if you want to rewire those circuits, you've got to have adaptive experiences that are productive in activating stress. Otherwise, they stay stuck. And if you change the behavior, remember the behavior is the tail end of the circuit, the weak part of the circuit. You're likely to get symptom substitution or addiction, crossover addiction, but still have an addicted participant. Okay, so let's go back and just remind ourselves that there are 5 brain states, and when we have these survival circuits and these maladaptive core circuits activated, we stay stuck in stress more of the time. What does that mean? It means that it's a real difficult situation, as you know, because when we have a stressor and we move away from brain state 1, what happens is just when we get to the state where we could actually unlock that circuit and begin to change it, before we know it, it's activated and we're using. And then one stress activation causes another and another, and afterwards we have this feeling in our body of an afterburn. And that bad feeling after we've used a hedonic reward. And at the same time, every time we use, the core circuits that are maladaptive this is actually incorrect. The core circuits are strengthened, the survival circuits are strengthened, and the brain set point goes down. I'll talk about that in a moment. So essentially, every time we use, the wiring in our brain that causes using gets stronger. You're probably familiar with this Coop slide, but the study of the first time someone takes a drink and what happens in their reward centers. But the important part is here you can see a progressive decrease in emotional set point with repeated usages. And this is important for the overall cause of addictions, which has to do with the brain being stuck in stress. So repeated activations of stress increases allostatic load, which is the wear and tear and adaptation of the brain and body from repeated activations of stress, and that feeds back on the brain, and just the structures that we need to keep us staying in a state of being present, not in a state of being stuck in stress, are cannibalized by the stress response. And at some point, we get stuck in an allostatic state, and that feels safe to us because it's familiar. So what do we do with emotional brain training? Emotional brain training trains individuals in brain-based self-regulatory tools to deal with the wiring, strengthen those homeostatic circuits, reconsolidate, in other words, unlock that circuit that says I get my safety from alcohol, and actually reform it as a circuit that says I get my safety from inside me. Unlock that circuit that says I have no power, and use those same neurons to create a circuit that says I do have power. Reconsolidation is the only way we know of to increase the chance that we will erase the circuit rather than just weakening it so it can be reinstated next time we're in stress, and to promote a homeostatic state. This is an article that I referred to at the back, which was from the NYU labs, which showed that it requires stress-activated emotional processing to reconsolidate a circuit. Cognitive training. You can't think your way to rewiring these circuits. You've got to go in the bottom of the brain and do it. Here's the study that I refer to later, which is they compared an approach where people actually activated a circuit, a memory that had been, there'd been a memory form that was a fear memory, and then it was essentially extinguished, but when it was extinguished, it was done with or without a stress activation. If it actually was with a stress activation to unlock that circuit, 3 days and even 1 year later, that circuit was erased. If non-stress techniques were used, there were fragments of that circuit still there, and when stress came, the circuit roared back and was reinstated. This happens all the time with our participants who are dealing with substance abuse disorders. They're fine until stress because that circuit is still at the bottom of their brain. So how do we begin to help? The first thing is we have to know how to self-regulate. So all we do is take the brain-based neurophysiology and attachment, secure attachment processes between parent and child that I showed you earlier and make them into tools. So people learn how to emotionally process. If you're in brain state 1, 2, or 3, it's not that hard to process. If you're down here, that's when people turn to excesses. So these tools are having a whole state of these brain-based tools that copy secure attachment are really important to have. And one of those tools that is for self-regulation also follows the pattern that we've seen in science of how you actually rewire a survival circuit. First, you unlock it with stress, then you feel your feelings, and then you spiral up to a state of dopamine high and connection, and that begins to rewire the circuits. Now, so we're moving from negative emotional plasticity to positive emotional plasticity. So here's the same person. Now they have skills in EBT, so they're moving away from stress. They know they're stressed. Now, a person that doesn't know these neuroscience-based tools would say, oh, my God, I'm stressed. What's wrong with me? I'm a bad person. I don't know. Who cares? They're going to dissociate, hyper-arouse, and they're going to go ahead and activate that survival circuit, and then it's back to the same old pattern. In EBT, people are taught stress is the new joy. Stress is a moment of opportunity. Every time you go toward a 3 or 4 state, you can actually use that experience. Don't reach for the pills. Don't reach to shoot up. Don't reach for the drink. Don't reach for the sugary fatty food. Reach for the EBT tools. And in that moment of stress, when that circuit is unlocked and ready to be reconsolidated, You give that circuit an adaptive, emotional, and cognitive experience so that essentially you weaken that circuit rather than rewiring it, and you move back to a state of one. So the core circuits are strengthened, the survival circuits are weakened, the brain set point moves up, and the person feels in their body, when you're in a state of connection, notice this in your own life, there is an afterglow. We are rewarded for getting back to a state of brain state one, neural integration. We are rewarded for reconsolidating circuits, in other words, growing and learning and changing with that glow. So we're looking at positive emotional plasticity. What we want is that same little kid to rewire their circuits so they know that they do exist, they are not bad, they do have power, they can do good, they can love, they are worthy, and they can have joy. And to be able to rewire those survival circuits so that I get my safety from emotionally connecting to myself. This is very important. Evolutionary biology says the only way we can be optimal health is to use our own prefrontal cortex to emotionally connect with our emotional brain, our limbic system, and reptilian brain. And from that state of neural integration, secure attachment, we can not only feel that love inside of us, that power, that ability to connect, but we can connect with others, and we can move forward developmentally in life. And so we have the space to be motivated by the hedonic rewards, not the hedonic ones. Okay, so the goal again is let's move up the set point. Instead of staying low, just trying to change the symptoms, which is the behavior, change those circuits, equip people with the emotional tools, rewire those core circuits and survival circuits, and have them stay with it until they have an abundance of the rewards of neural integration and a homeostatic set point. So what does this mean for substance use disorder? You all have studied substance use disorders. You all have a lot of experience treating them. When you approach this fresh from a simple neuroscience perspective, that this is about circuitry, it's a bit of a shift. And it means saying, okay, now what works here and what doesn't work here? And I'm just giving you a few ideas. The first thing is you're focusing your attention on your participant in terms of it being a circuitry problem. And even though the behavior is maladaptive and may create such overwhelming stress for a participant or damaging to their health, happiness, and ability to create relationships and function in life, still keep in mind that the behavior is the tail end of the circuit, the least powerful part of the circuit. Now, with more addictive behaviors, that's not the case. But in general, the idea with these circuits is focus on the emotional expectations and the emotional activation, because that is promoting the behavior. Know that the set point of a participant is really essential to constructing an effective care plan. I'll go into that in a moment. You're going to treat people differently based on their set point. We want to change the behavior to the extent it's damaging, but we also want to rewire the circuit to turn off the emotional drive so it's easier to rewire the behavior, but also the circuit was encoded during a moment of trauma, during a moment of disconnection, during a moment of loss. And until the feelings are felt, and that's what the cycle tool does, and the expectations change, that's what the cycle tool does, that they will not really be free from that emotional drive, because it's really calling to them to heal the past. So every time they use, you say, oh my gosh, of course you're doing that because it's a circuit. Let's find the circuit. And they do the emotional processing to go into their unconscious mind, find that circuit, and then begin to feel some of the feelings they had in the past at the moment it was encoded, and begin to emotionally process those. So again, one of the big take-home messages is we haven't been willing at times to go into emotions because they were so complicated. They were so amorphous. They're so unending. It turns out when you look at the emotional brain from a neurophysiology standpoint, it's highly organized. And it's organized uniformly in a way that we can actually begin to train people in tools and how to interpret those layers in the brain based on brain states. So We know that rewiring only occurs with repeated emotional experiences that are stress-activated and bring us back to a state of connection and well-being. We cannot cognate our way out of substance abuse disorders. In EBT, to give you an example, the context is, what are you doing about your circuits? This week when we met, because we meet with a certified EBT provider in a telegroup with 6 participants, so they can come every single week, no excuses. It's easy to show up on the phone. And you say, how many times do you check in and self-regulate? How many times did you do cycles this week to rewire those circuits? How many times did you make community connections, 5-minute calls to use the circuits because we know cycles, because we know that these emotional circuits are encoded and re-encoded best in a loving community. It's peer-to-peer support over and over again that begins to make this tool work more deeply and effectively in the brain. And they have to know, with self-directed, professionally facilitated neuroplasticity, how to do this. So the learning of this through videos and workbooks is really, really important. We want them to stay with it, not until they're just abstinent, but they have all the rewards of a homeostatic state. And those eudaimic or prosocial rewards of development, human evolution, are sanctuary. And for example, if you were a participant and you had been in EBT for a year, 2 years, whatever it was, you'd say, absolutely. How do you know that you have a homeostatic set point? Because more often than not, you have an abundance of sanctuary, peace and power from within. Authenticity, feeling whole and being genuine. Vibrancy, healthy with a zest for life. Integrity, that sense of doing the right thing. Intimacy, giving and receiving love. Spirituality, being aware of the grace, beauty, and mystery life. And most of all, freedom. The whole range of common excesses have faded. Doesn't mean they won't ever happen again, but they're not dominant in our lives. And so we can move forward with our lives to live a better life for ourselves and others. And so we essentially educate them about, hey, you need to get down to brain state 4, and what happens is you're going to unlock that circuit. You're going to feel your feelings and switch that to a new circuit. I get my safety from drinking, I get my safety from connecting to myself. And then you're going to say it over and over again using Hebb's law to wire that in until you feel you're in a state of neural integration, being present, and essentially enjoy to lock in the new circuit. It's just a wire. You can rewire it. And so let's focus on mapping out what are those circuits that are getting in the way of your state of connection. And again, this is all done at a very, very low reading level and very concretely, so people can begin to take charge even though it's professionally facilitated. Hey, what are your core circuits? I do not exist. Well, if I don't exist, how am I going to go forward in life? Or if I'm bad, let's rewire those circuits. Where do I get my safety? All these survival circuits are really important because most people have more than one excess. And even though they may be more concerned about the drugs, the spending gets in the way, the tech gets in the way, the food gets in the way. So they're identifying their various survival circuits that are behavioral. This is an important point, that in the brain, when there's a behavioral survival circuit, it is always rooted in an emotional state that is addictive and unconscious and out of balance, allostatic. So those circuits, our attachment to being hostile, depressed, self-pitying, anxious, panicked, shame, numb, thinking too much or false highs, those circuits need to be rewired as well in order to get better adherence with behavioral change. We know that in stress, people merge or distance, and that decreases our ability to emotionally connect with ourselves and others and get healthy rewards, and so those circuits need rewiring as well. People need to know their set point. It's typically 4 or 5, and we want to move it up. Even if it comes up to 3, that's a huge change in almost every aspect of life. So they learn with an app and with the computer and with each other how to figure out their brain state. How do you feel? This is a simple way of doing it. But you can see here that it's interesting that every single aspect of life, cognitive, emotive, relational, spiritual, and behavioral, are all brain state related. I teach a course at UCSF on EBT and the medicine and the physiology of EBT to medical students medical students go through EBT training, the 8-week program, just before they get into their rotations because they need that to prevent secondary stress. What the big take-home message here is that our current medical system is vertical. We look at a behavior and we want to nab it, but the brain works horizontally. If we're in a set point of 4, we're going to have unbalanced, maladaptive behaviors in every area of life, and maybe multiple in each domain of life. And each out-of-balance, maladaptive area makes it harder to change any one. It's a horizontal world in terms of medical care. It's a state to change the state, which is the state is always changing, and eventually the trait, which is the set point. And that's the goal of EBT. So check in and find your brain state and start spiraling up. Make it fun. Use emotional housekeeping. When they first start their EBT Basics course, they've got to learn how to emotionally process. Fortunately, the skill for Brain State 3 allows them to learn that if they go into their negative feelings, they actually turn into positive ones, and it feels so good. So that feels safer, so they can learn the cycle tool where they go deeper into their negative feelings and actually come out the other side with changing that circuit. Okay, so how does this apply to healthcare settings? We have to be practical here. We know that we have many different kinds of participants, and we know that the first thing to figure out is what their set point is. If their set point is 5, EBT is not a good choice at that time. What they need is medical care, one-on-one counseling, and support. It might be detox to get them up to a set point of 4. The reason is the brain changes at learning occurs at brain state 4. At 5, the brain shuts off. So when they get up to 4, they're going to be able to go into EBT as one of their treatments to move up their set point, where there's less medical, less one-on-one, and it's easier to change your set point. If you use this method and your set point is 1 or 2 or 3, you can go through the whole program in 6 months. People who are down here are going to stay with it for several years. Okay, so people start by saying, hey, let's get some basic tools in emotional processing and how to rewire some of those circuits that are getting in our way. It has to be fun, and it has to be exciting and meaningful, or the reptilian brain shuts off. So they come for 1 hour a week with an EBT provider. They've got an app so they can connect with each other and message each other and use the tools and have the videos there for themselves. They have a private confidential phone system so they could push a button and reach someone else, so that 5 minutes to 10 minutes a day they do the cycle tool with someone else who's in their group and do what we call the community connections. That just takes 8 weeks to get the basics down. After that, they can begin to go into the advanced courses. Again, they're getting more buddies and more support, and they go through essentially 7 courses. Each course takes anywhere from with someone whose set point is 2 or 3, it takes maybe 4 weeks to go through. Someone whose set point is 4, it's going to take 2 or 3 months to go through. But these are all calibrated courses with videos and workbooks that train in each of these eudaimonic rewards, but also are calibrated to the moving up set point in the brain. As the set point moves up toward freedom, the brain is much more plastic. It is much more flexible emotionally, and it is much more expansive. Just think of broaden and build theory. Okay, so how do we actually do this? How do we get people to do it? Well, we essentially make it fun, and we also give them tons of attention and connection. The traditional, because we know that the implicit memory systems where these circuits are encoded only change by experience, not by knowledge, insight, planning, or decision making. It's all about practice. And so we take the old model and we say, okay, what can we do? We can not only have our telegroup, but they're going to have peer-to-peer support. They're going to have their e-learning with videos of people using it and learning more and more about how to do this well, rewiring one circuit or another each week. And we're going to make it also very, very much of a community of people who all have the goal of being at a homeostatic set point, essentially being wired at a higher state and having those higher order rewards be real in their daily lives. And so that means the app, the website, making it fun. And so what is this? How feasible is this? About 2 years ago, we had a survey, and we asked people how they would feel if all of a sudden EBT disappeared from their life. They didn't have their groups, they didn't have their app, they didn't have their community connections, they didn't have their community. 78% of people said they would be very disappointed. Retention. 76% of participants continue after the 8-week course. There was a UCSF program on pregnancy and EBT, and again, they were astonished at how much people love EBT. Engagement of participants who continue, the duration of participation tends to be quite long. They stay with it because they attach to their provider, they attach to the tools, they attach to the idea of the kits, and they attach to each other as they help each other move up their set point. There have been 10 studies from different universities on EBT. The addiction part of that is food addiction to date. We obviously want more studies at looking at other addictive behaviors. One study just came out, University of Kentucky, to show you about addiction. These were actually people who were obese, and EBT was compared to a mindfulness program versus EBT. I'm just going through the basics. And what we found was with the EBT, it produced significant changes in weight, blood pressure, perceived stress. In other words, physiological change as well as food addictions, and these changes were sustained at 7 weeks. Whereas in the mindfulness group, there were no significant changes at end of treatment or at 7 weeks. Again, pardon me. With food addiction, you can see that 50% of the population was clinically significant, and that was reduced after 7 weeks, and that was maintained after 14 weeks. So it gives you an idea that we may be getting at the root cause by rewiring, reconsolidating these allostatic circuits and the emotional tools of self-regulation. So this work is technology-based, it is evidence-based, but it needs a provider. And so EBT professional certification has been going on for some time, and what it starts with is first trying it yourself. You can't teach tools that you haven't used in your own life and that you believe in. So that's the first step, and then it's distance learning until you can be certified as an EBT provider. There's also advanced certification. So what have we talked about? And I'll open it up for questions. Emotional brain training is a neuroscience-based intervention for stress-related problems, including substance abuse disorders and extreme behaviors. Participants learn brain-based tools for effective self-regulation and allostatic circuit reconsolidation with the goal of establishing a homeostatic set point. Health professionals become certified in EBT and deliver technology-assisted telegroups and coaching. And here are some selected references that will give you more of the science if you want to look a bit more into that. In terms of research and training, there is an EBT practice-based research network. Professional certification is distance learning. You can see about that here. And the first step is to actually go through an 8-week, 1-hour-a-week telegroup to see how these tools work for you and whether this fits with your personal and professional orientation. So thank you very much for your attention, and I would really welcome any questions you might have.
Thank you, Laurel, for going through that information. And in the meantime, Laurel, we have 2 questions in the queue. And Dee, do you mind posing some of those questions while I unmute the line?
Yes. Hi. So the first question is, how do you get trained and certified? And if we can put the website back up. So I think this is the slide.
There it goes.
Yeah, there we go. Laurel, do you want to say a few words again about how to get trained and certified for EBT?
Yes. The first step is to go to the website ebtconnect.net, and we have a waiting list to get into that course, but we're opening up a whole new series of those experiential courses the second or third week of July. We want you to learn how to do this by first doing it yourself. So if you first go through 1 hour a week called EBT Basics on a telegroup, and you learn the skills and you start playing with them, you start playing with the app, you start learning from the videos, and you start saying, wow, does this sit right with me? After that time, then you apply for enrollment. We certify licensed mental health professionals as well as health coaches. We have found that the people that are best suited to this are people who are comfortable with their emotions. Remember, brain training is fun, and it's also very deep. I just did a group this morning, and people go, when they're using the cycle tool, they go into, we're teaching them how to just say what's bothering them. Like, the situation is I got drunk last night. And then they go into a level of anger. It's called A+ anger that actually unlocks a circuit that's both safe and effective. And they'll say, I feel angry that I did that. I can't stand it I did that. I hate it I did that. And they'll even be expletives and shaming and blaming. And at that point, the circuit is open, and they switch to feeling their feelings. I feel sad that. I feel afraid that. I feel guilty that. And the guilt statement will point them right to the unreasonable expectation, which they have not been conscious of. It might be, I get my love from alcohol, or I get my safety from hiding, or I get my safety from going numb, or whatever that is. And once that realization occurs, then using Hebb's law, which is the neurons that fire together, wire together, and get stronger, and the other ones get weaker, they say the opposite, that it's a very special technique they use to stay deep in the brain so it doesn't become neocortical. It stays emotional, and they actually spiral up to a state of 1 and weaken that circuit. In order to be someone who wants to do that, you learn how to be really comfortable with negative feelings. You also learn, because this is the goal of EBT, being it's a homeostatic set point, is the same as neural integration and is the same as acquired secure attachment. So you as a provider need to be a good parent, and that means the authoritative parenting style of just tons of warm love and nurturing and very high expectations. You can do that. Let's get that circuit rewired. So it has to be compatible. If you prefer a quieter approach, a less emotionally expressive approach, this may not be up your alley. So also, the provider is different than a counselor in that there's appropriate self-disclosure. If no one in the room is using the cycle tool, like I just went on a vacation with my partner and met a whole bunch of people that were very rejecting to me. They'd known my partner forever. They weren't happy about his divorce. And even though it's been 4 years, they weren't happy. So I had all this negativity coming to me, and I got into a little survival. I get my safety from hiding a little bit, okay? So the provider is going, no one was particularly talking about their circuits this morning, so I said, well, I had that circuit come up, and let me do a quick and easy cycle on that to spiral up. So appropriate self-disclosure, just not for yourself, but to model and inspire other people. You have to be willing to do that. And essentially someone who, it's a love relationship, as counseling is. So you're here to support them and cheer them on, to do that work and to rewire those circuits, to connect with each other and to move up their set point. And so it is a loving relationship. But generally, licensed mental health counselors and also health professionals who have an orientation of education, that they believe in this and want to give these skills to others, and also health coaches. So we have a broad range of people who are qualified to do this. There is basic certification, which I've covered here, and you can get that done after you've gone through the personal training in about 8 weeks, and then you actually deliver an EBT basics course on our portal, because all the work is done in the telegroups because it's more effective. And the reason telegroups are more effective than on-site is because people can arrive there no matter what. It's just an hour. They can be on vacation or they can be at work. They can take the time off. And what we didn't realize when we started these telegroups about 20 years ago was that in utero, the baby first bonds with the mother's voice. So the vocal tone, the voice of the provider and other people activate legions of emotional circuits in the brain. So it's very, very effective in doing emotional work. And so essentially then after 8 weeks of, going to a seminar once a week and doing some e-learning, and demonstrating and role-playing that you know how to coach these different skills, then you go into actually doing it yourself. And you have a mentor who's an EBT trainer who co-leads it with you. The first time you do it with someone, else, so you have complete support. We're here to support your success. And then you can give these courses on EBT Connect, and it can be part of your organization. You can have your private groups or whatever you like. And then if you want, you can continue and go through the 7 kits yourself and be certified to train people in the advanced kits. But the first step is to get basic certification.
Thank you, Laurel. That actually answered a couple of other questions that we had in the queue, so that's good. There's another question here, and he asks, are there studies with functional MRI and EBT with narcotic addiction, so related to narcotics?
I love that question, and the answer is that we do not have studies other than the studies, for example, that were done by Jeffrey Schwartz in Southern California, looking at OCD patients with using some of these same techniques that showed changes in the brain based on the experiences of emotional experiences in rewiring the survival circuit. We need a lot more data on that, and we really are very excited about the possibility of some people wanting to do more research. The research at Cornell is really on low-income people, pregnancy, heart disease, and obesity. In Kentucky, it's the same. At UCSF, we've done studies on adolescents and also pregnant women, low income, and we're looking, these are addictive circuits, and we do know that if someone is actively using a substance to the point that they're at a set point of 5, EBT is premature. We want to get them medically treated, detoxed, and supported. But the sooner they get into a warm community that has these tools to self-regulate and to begin to see their problem as not being something shameful, but circuits that are encoded in the first part of life and also later during stress when our brain isn't working very well. But these circuits are our responsibility. We are the only ones who can rewire them, and we do that in loving community with powerful tools, and we stay with it until we've rewired for a secure connection.
Thank you. I see another question. How does this differ from EMDR?
Very different. Number one, the issue is that with EBT is we are rewiring for secure attachment. That means that the circuits of we teach people to emotionally self-regulate, and that's essential. This is all based on brain physiology. These 5 tools for these 5 brain states are required to get out of the ditch of brain state 4 and 5. Number 2, we in EBT do not just break down the circuit. We reconsolidate it. What I mean is it doesn't help to erase a circuit and let it go, because that circuit was actually the pathway to a deep hurt. And that deep hurt needs to be healed, and that basic expectation, such as in that moment of trauma, I felt like I do not exist and that I get my safety from hiding, needs to be rewired to a circuit that's homeostatic, from allostatic to homeostatic, that supports a secure, loving connection, which is I do exist and I get my safety from being present in the moment to myself. So we don't just alter the circuit. We reconsolidate it to an adaptive circuit, which promotes the set point moving up. In addition, with EBT, it's not provider dependent. Your job as a provider is to give people these tools. Teach them how to plant the seeds, the rice, rather than giving them a bag of rice. And so even though they come to your group every week and you give them your provider coaching so they can use these tools more effectively, you can coach with them about which circuit to work on. You do a lot of coaching. But the fact is most of the work that is done outside the professional realm. Between sessions, they connect with each other typically once a day. A group of 6 people will tend to have a total of about 30 or 40 community connections a week, because we have a portal so we can keep track of their practice so that we can promote people in being successful. We catch them before they don't have success. And so we want them to be having lots and lots of experiences, because that's the only way the brain changes. We stay with people until they're wired at 1, and it integrates healthcare. They need healthcare to decrease the stress in their brain, and it also includes a brain fitness lifestyle of the 3 most important factors, which are sleep, exercise, and food, because we want to rebuild the brain and body so they can have a wonderful life. So those are the differences. EBT typically takes 2 years, sometimes 18 months, sometimes 3 years. Some people stay with it ongoing in order to support others in moving up their set point. So it's set up for the long term and is not exclusively provider dependent.
Thank you, Laurel. And we have one last question here in the queue. How does this work with people who are very uncomfortable with emotions? For example, someone that says, I'm not overeating because I'm depressed, I just like food. Do you have any tips for engagement in this process?
I would say there's a couple of questions inherent in that, so let me see if I can sort them through. The first thing is that going to EBT is voluntary. And the first thing we say to someone is, the problem is circuits. They happen to be emotional circuits. But we stay with you until you have these rewards. What is the reward you most want? So it is not a reasonable expectation for someone who has a survival circuit to want to give up their survival circuit, because they're on an unconscious level, they think they're going to die. In addition, even though they or the provider has identified a key survival circuit, like I get my safety from alcohol, no one has just one. And that circuit's not going to result in behavior change unless the emotional and the relational circuits and the other behavioral circuits are rewired themselves. With EBT, we start right where people are. And when they come into the group, we first say, let's figure out what your circuits are, or if you have any of these circuits. Everyone identifies some of these circuits. The problem is not you, it's just circuits. And you can sit in this room and do absolutely no work at all. Every time I come to you, you can say pass, and you will still get an A+ in this course. Because even just being in this room and listening to other people process emotions will actually, because the emotional brain has no walls, will go into your emotional brain, and in time you will notice that you are more and more comfortable with your emotions. Also, we teach the emotional housekeeping tool first, and anyone who uses that turns negative emotions into positive ones. I'll do it for you right now. It's just 8 sentences. And let's say I'm in brain state 3. I'm just finishing this conference, and I'm a little stressed. And so I'm going to say just complete 8 sentences, 4 for the negative emotions and 4 for the positive ones. And sometimes it won't make sense, and they're going to be on all different topics if I'm at brain state 3, which means a little stress. And we'll just see what happens. And your job is to be a loving presence for me, and if we were in an EBT group, then you would share the feelings and sensations in your body to give back to me. So I'll just try that skill. I feel angry that my son is mad at me. I feel, remember, it's coming up from my body. It's not neocortical. It's bubbling up from my emotional brain. I feel sad that my dad is sick. I feel afraid that I don't have any fear. Cool. I'll go on to the next one. I feel guilty that I was late today. Now that I've cleared away the negative feelings, the brain naturally moves to the positive one if we're in a brain state 3, a little stressed. But I feel grateful that Tracy came to my rescue, and I feel happy that you're on the line with me, and I feel secure that my son will probably not always be mad at me for the rest of his life, and I feel afraid that I feel proud that I showed up today. Woo! So you begin to teach people tools that actually allow them to be successful in feeling better, and tell them they don't even have to do any of it, and in time they can't help but get engaged. So you say, don't do anything that doesn't feel good to you. Your safety is the most important thing. Hang in here as long as you want to. Anytime you don't feel safe, just drop off the phone. Just come back to the next session. You'll be amazed. Or just watch the videos. Read your book. See if something interests you. Otherwise, just set it aside. Let's make this fun. So there'll be some people that won't come into the group, but it's amazing how many people catch the idea of EBT and catch the power of it. So sometimes people will leave EBT, but frankly, most times they come back because once they've been infected by the neuroscience ideas and the tools, they can see the benefit in their lives, and oftentimes they take a break for a while and then come back. But essentially, we start where they are, and that's why you need a provider. This is not automated to be sensitive and warm and caring and individualize their EBT throughout.
Laurel, I want to thank you very much. This was so informative and interesting, and really on behalf of the CTN, we're really happy that you could join us today and that you provided this presentation. If anyone has any other questions, maybe you could contact Laurel directly. I know there's a lot of information here. Tracy, I know that you also wanted to say a few words about the dissemination library.
Oh, absolutely, because we're going to make this available later. If you want to listen to it or share it with others, we're going to put it on the CTN or have the librarians put it on the CTN Dissemination Library's website in about 10 to 14 days. And we'll also post a copy of the slides there. So that will be our resource on EBT, and then it'll also have a link to connect with Laurel because she is the expert.